open house. We're so excited you guys can join us. So anyway, so yeah, we've got a lot going on tonight.
Jerry Scott says hi.
Do that.
Jerry Scott says hi.
Hey, oh my God, Jerry! I love Jerry. He was a band member with Led Zeppelin at one point. How you doing? Hopefully we'll meet up soon. Miss you a lot. So yeah, we'll start with like Botox tonight, and then we're going into Coolsculpting next with Chris. And then we're going to do CoolTone, where you actually can see that machine like tightening your abs, your butt. We're also going to be doing someone's lips tonight, which is very exciting, as well as microneedling. Have you heard about the vampire facial that the Kardashians made kind of famous? So we'll also be doing filler in the cheeks and the eyes, the lips. We're going to be doing Botox, and we're actually going to be Botoxing my husband Richard, Dr. Laconi, at the end of the show. I mean, he needs it. He's usually the last person invited around here, so he definitely gets it tonight. Will there be questions from you guys? And we actually love to have questions, so we're going to be going into each provider, so please ask your questions. This is an opportunity like no other. Like usually we have a lot of people here on live events. There's so many people, it's hard to get your questions answered. We're going to go into each individual room with each procedure, so ask your questions and we will answer them in about. So we're going to be doing these events twice a month. We're going to be doing different procedures. So we want to know what you're interested in, and we've got so many things to offer you guys. We just purchased a brand new laser during COVID to get rid of your brown spots, your red spots, improve your skin texture. It's amazing. So yeah, come on in and see us and schedule a free comment. Oh my gosh, we have a VC skin analysis. It's a computer complexion analysis that will show you all the damage underneath your skin, what we can do to improve it. So anyway, come get that for free. All right, so where are we going, Shannon?
We're off to see some Botox.
Okay, try to lift it. All right. Sorry for the vibration, guys. Okay. There's Melissa. And Nancy, of course. So what areas are you going to treat?
So we're going to do her forehead, Botox, we're going to do her forehead, and then we're going to do between her brows, her bunnies, and then her crow's feet around her eyes. And then obviously lips.
So Nancy is our nurse that's been here. She's a registered nurse. How many years have you been here, Nancy?
10 years.
10 years. And she is an amazing injector. I mean, she does an amazing job. She's and gentle and sweet. We call her Nurse Nancy.
Hello, Nancy.
Oh, someone just watched us on Houston Live. Thank you. It was a lot of fun. Someone said hi, Nancy.
Hi.
Hey, Nancy. So what are you doing right now?
So we're going to mark her so that we know exactly where to do her injection, so she doesn't have to keep lifting her brows and moving.
In case you're wondering what all this white stuff is on her face, she's getting numb. We're going to actually, Nancy's going to do her lips, and Dr. Laconi is going to do her cheeks a little bit under her eyes. She does a lot of Zoom meetings, and she's feeling that kind of tired look, right? Is that kind of what you're experiencing? She's a busy girl, yeah, and with two kids, young kids running around, so she's...
These are very busy.
So she's basically doing what we did on the show today with Casey, just getting her Zoom face ready, and she hasn't been in a while.
How many units are you guys looking at today?
We are doing 62.2.
62.2, that's total. She's in her forehead, around her eyes, her nose, yeah, her crow's feet, so yeah, she's taken quite a bit, but she really does it for prevention. That's
What are all the
she
areas-
looks so smooth.
Then what are all the areas you can use Botox on?
For cosmetic, we do it on the forehead, the crow's feet, the nose. We do lip flip. I know a lot of people are curious about lip flip, so we can do it on the lips, the chin to stop the clenching. We can do it in master muscles where people are grinding down really hard. Oh my gosh, it's something that's really awesome is like in the platysmal bands. A lot of people don't know that. You have like these little bands that you eat. Like in fact, I have them right now. You can put it in here just to relax those. We can do it for hyperhidrosis, like under the arms.
She's great about doing her Botox, so she does it every 3 months.
Yeah. And so the bumps you see here, they're going to be gone in 5 to 10 minutes. So it's really not a big deal. She can go back to work.
And she looks so natural.
Yeah,
too.
she does look natural. We like that natural look. So when she leaves here, she's going to be soft and subtle. She'll still have a little bit of movement.
Questions coming through on Botox. How do I get that natural look, that perfect brow versus that kind of heavier eyebrow? How do I get that perfect lift and look?
So the way we Botox, we can pretty much examine your muscles, and you have to be careful on the dosing and the forehead. We know how to do it. We're trainers. We train doctors and nurses how to do it here. Dr. County does. So you go kind of like, you just treat it in the middle. You'll get a brow lift. If it goes too high, we can put a little Botox here to kind of relax that so it has a natural, smooth look. So we do not like that spark eye or that frozen look, unless someone really wants it. So how are you doing?
Dana, where do you get Botox?
Nancy does my Botox. Nancy is amazing. All of our injectors here are amazing. I mean, everyone here is so amazing. They're so gentle.
How long have you been getting Botox?
Okay, so I actually went to Canada before it was FDA approved here in the States to get my Botox by Dr. Mark Bailey, and we were actually being trained with all the Hollywood doctors in Canada. So we've been doing it a long time. We were one of the first. So yeah, I have been Botox for so long that even when my Botox wears off, my muscles have lost their memory. So I don't know how to frown or smile, but I don't think I look unnatural. It's just, and then when I do Botox now, it's just smaller amounts than what I've had in the past.
Melissa, what about you? How long have you been getting Botox?
It's been about 6 years.
Awesome.
And Nancy is amazing, and my mouth is numb. But doesn't hurt at all.
So we have a few questions on filler. If you guys want to keep injecting, talk about filler.
Sure.
What kind of filler do you use around the eye area? What kind of filler do you guys use? There's a lot of kind of filler questions coming through right now.
So, again, we have about 5 different Juvederm fillers that we use. And, we'll use the volume in the cheeks where you're really wanting to get some volume. Our favorite Juvederm filler for under the eyes, like under here, where you kind of get that tired look, that loss of volume, is velour. It's very soft. And the beautiful thing is with volume and velour, it lasts up to 2 years. And it's just amazing. And then for the lips, we use a different products, anywhere from the Juvederm Ultra Plus to the velour. The biggest complaint that we're getting right now are the dark circles under the eyes, or the loss of volume, or the loss of volume in the cheek area. So volume and velour are our 2 favorites, but all the products are wonderful. There's a different product for every.
Melissa's getting a ton of compliments, so right now everybody thinks you look gorgeous. But everybody's interested. What kind of filler do you plan on using on her lips today?
Juvederm Ultra Plus.
Okay.
That's what she's had in the past, and it works well for her.
Or what does it feel like right now? Does it hurt? First time Botox users out there.
Doesn't hurt at all. Maybe a little pinch for a second, and then it's gone. Yeah, doesn't hurt.
Your lips are still numb, huh?
They are.
Yeah, sorry.
Okay, well, I think next we're going to go to the Coolsculpting room. Are we ready for the Coolsculpting?
We're ready. Okay. Here we go. Hannah Swigard says hi.
All right, here we go. So here's a sexy Chris is looking for a lady. Anyone interested? Sorry, Chris. All right. Anyway, so
So we're here to talk about Coolsculpting. We're going to focus on this lower pooch that both men and women tend to have. This is the most stubborn area for most people because we all know no matter how much you work out, abs are actually made in the kitchen. And unless you're eating a super boring diet, you're probably going to have this. Before y'all came in, I went ahead and marked him. We're going to do one of the Cool Advantage Plus applicators in this area. And then in about 30 to 60 days, he'll come back in for his second treatment. So I'll let you go ahead and hop up on the bed. Nice and comfy. Here in our Coolsculpting room, we have a nice comfy bed. We also have Netflix for all of our patients to watch.
let me adjust the camera so you can see a little bit better.
So what I'm going to do now is I'm going to start with the pre-treatment white. wiping down the area that we're treating. We mark beforehand because when you lay down, the area changes and we want to make sure that we're treating the right.
Yeah, here's some pictures, some before and afters right here. Chris, you're gonna look like that in about 6 weeks.
Sweet.
All right.
Just in time for the holidays.
Yes.
So Chris, this is your first time, right?
Yes, it is.
Yes.
And you work out, right? On a regular basis.
He hikes a lot.
Not really since COVID started, but I mean I used to. But even when I was working out, this was always an area that I could never really get rid of. So
And Natalie, what kind of patients do you typically see come in for Coolsculpting?
The best patients are going to be ones that are already active, eating a pretty healthy diet,
Peggy.
and just have that stubborn area of fat. Put your arms up so they don't get sticky. Protective gel pad, maybe go ahead and apply that. It is going to be cold. You can just relax your arms now. I just want you to get sticky. So going back to the ideal patient, it's going to be those patients that have the stubborn fat in the abdomen area, the love handles. On women, we can treat the bra fat. We can treat arms and inner thighs, but just remember that you want to have good skin laxity so the skin comes back when we're treating those more stubborn, kind of difficult areas. But the love handles in the abdomen, pretty much great for everyone. Just know hernias in the area. And if you had a C-section, within at least 6 months after pass, in 30 to 60 days.
All right, show us when you put that applicator on. Show them how it just kind of sucks the fat up inside.
Yes. I'm gonna have that there to hold it. Are you comfortable how you're sitting? You're gonna be like this for 45 minutes.
good to go.
You're good to go. Okay. So we're gonna turn this on. Basically, we line it up. Perfect. How does that feel?
Woo.
Feels good.
Only you would say that, Chris.
How's the section feel?
Fine.
Perfect. Feels like it's on there?
Yeah.
All right. There we go. And the countdown begins.
So what's happening now? It's kind of cooling down.
It's going to cool down, freezing those fat cells causing cryolipolysis so that his body will just naturally get rid of them over the next 8 to 12 weeks.
So right now it's basically getting cold. So do you feel any pressure, Chris?
Yeah. So it's sucking up my fat into this machine, and yeah, it's chilling it out. I mean, it feels fine. It's not painful or anything like that.
Yeah, it starts to get cold and then it gets to be slightly uncomfortable. Think about sticking your hand into a really cold ice chest. It's like that for about a minute or two and then it goes numb and you're perfectly fine. After the 45 minutes are up, you are going to have a massage in that treatment area, breaking up those crystallized fat cells, also rushing the warm blood to that area, causing some of the injured fat cells to go into shock and be killed as well.
Do you recommend any special diet / fasting before treatment?
No, there's none of that. Some people do recommend drinking a little bit more water the day of, but not necessary.
And what about stubborn fat? What do you mean by stubborn fat?
So stubborn fat that's resistant to diet and exercise. So think like that lower pooch like we're treating here, even the love
Pinchable.
handles. Yeah, pinchable. It's subcutaneous fat. So when it has to be pinchable and squishy. So if you have like that hard belly that still sticks out, that's most likely visceral fat, which unfortunately is behind the muscle and Coolsculpting cannot treat it. We have it right here. So this is about 1 pound of fat, and this is what approximately 5 pounds of fat look like. So muscle weighs more than fat, so we want to, 1 pound is not equivalent to 1 pound. Pound of fat takes up a lot more space, so we want to get rid of it. We don't want to be rolling around with this on there.
So how much does each treatment get rid of?
It gets rid of approximately 20% of fat in the treated area. So that's why you want to do 2 treatments typically to devolumize, and then I like to wait about 3 months after that second treatment to see if we really need a contour. Most patients, with as long as they're doing their normal diet and exercise, are very happy with the results, but there are some cases where a third treatment is needed.
What is the difference between CoolTone and Coolsculpting?
So with Coolsculpting, we are devolumizing and we are killing fat. With CoolTone, we are actually building muscle. So there are certain patients that technically can be a candidate for CoolTone, but they probably want to Coolsculpt first just to devolumize so that they'll get better CoolTone treatments. And you can actually do them at the same time.
So the top one, what's the top and bottom pictures we're looking at right
So
now?
this top one is going to be Coolsculpting, and then this right here is going to be the CoolTone where she's actually built more muscle in her core in that abdominal area.
Perfect.
And yes, we will be demoing the CoolTone in just a couple minutes. Are there any more Coolsculpting questions? Natalie, can you go again over how much one treatment costs?
So with this, every treatment is customizable. There's so many different ways depending on the abdomen. For this treatment and for this specific patient, he was just concerned with that lower abdomen. What worked best for him was going to be one Cool Advantage Plus. There are also the Cool Advantage Petite and the Cool Advantage, just to kind of show you an example.
So what are we looking at here?
These are my templates to go over so I can plan a treatment. Here are these. So what worked for him, for example, is the Cool Plus, the Advantage Plus. So we marked this out right here, but in some cases, depending on the hip width and the size of the patient, they might need two overlapping. And the two overlapping are different. So that's why we need everyone to come in and actually have a visible consultation so I can pinch around and see how the skin pulls so that we can give you the best possible treatment. We can do virtual consultations to make sure that you are a candidate and kind of go over things with you. And then just know when you actually come into the office, we might have to tweak it a little bit.
Chris, how's it feel?
It feels fine. I mean, the whole kind of analogy of sticking your hand in. Yeah, the whole analogy of kind of like sticking your hand into a cold ice chest is pretty accurate. It's not even that bad though. You know, if you stick your hand into an ice chest for a little while and you're digging around, it kind of hurts. This, I would not say hurts.
So Natalie,
It's just cool. Yeah.
who's the best patient for this?
For
Coolsculpting?
For Coolsculpting, hands down, I say it's for those stubborn, resistant areas. So patients that are dieting and exercising and that just tend to have that lower belly, that have the love handles, that little muffin top. Those are where my patients are getting the best results. You want to be at your ideal weight, just maybe have that stubborn pocket of fat.
So what if we want to lose like stomach fat plus love handles plus outer thighs? Like what's the best place, or is that what the consultation is for?
That's where the consultation is going to come in. I have a handful of patients, actually most patients, we do recommend doing the abdomen and the love handles. Just from in the past, when patients focus on one area and not the other, they always come back and treat the other area. So we can do a consultation where we give you the both areas, plus we can give you the consultation where you're just doing one or the other.
And how long does it last?
So this treatment right here is a 45-minute cycle. So he will be finished in 38 more minutes. With the Cool Advantage and the Advantage Petite, those are 35-minute applicators. So depending on how many applicators we do, would depend on how long this treatment is.
And this, once you treat, is it done? Like once you kill the fat, you kill the fat?
We kill the fat, we kill the fat. After puberty, the amount of fat cells you have. So as long as you continue to eat healthy and exercise, the fat should not come back to that area. But if you do fall off your diet and stop exercising, the fat can come back. And just like liposuction or any other fat removal, it can come back somewhere else.
Thank you for logging on. Hope you're learning a lot. So anyway, we're going to go back and see the CoolTone in action. That's the treatment that's going to help stimulate muscle contractions to help tighten your abs and your butt and your thighs. Follow me.
Yeah, really good.
We'll introduce, by the way, here's Dr. Laconi.
Hello. Welcome aboard.
Welcome aboard. This is not a vote. It's an open house. But anyway, he is the mastermind behind all of this. All right, follow us.
How many of you guys out there saw us on Houston Live today? Give us a high five.
Hello. Hey guys. Hi. How you doing?
Doing well, how are you?
We're watching. about the cool tone. Sorry for the vibration, guys.
So we are doing a cool tone treatment on Chelsea here. She's getting her abs treated, as you can very well see. We're instigating some really strong contractions that are even better than what you'd be able to get if you worked out on your own, even to your absolute max. The machine will help you achieve a stronger, deeper contraction and more of them. So you're doing a ton of work in only 30 minutes. She's on her 4th treatment, and she's been coming regularly over the past 2 weeks with a couple days in between. And that's usually what we suggest is a series of 4 spaced out over 2 weeks with a couple days in between, because you can get sore. Weren't you just telling me that you can actually get sore from this?
Yeah, you get really sore.
Yeah, some people get varying degrees of soreness, especially on the abs. So she's on her last treatment. We've got her all the way up to 100%, and it's basically using magnetic muscle stimulation to achieve those contractions. And it's a pretty cool technology that we have here. We're so excited about.
I hear that you've done M-Sculpt before in the past. What's the difference?
I think this one makes you way more sore. So it seems to work. Made stronger.
Yeah. So yeah, you can actually, if you look close, you can actually see her muscles contracting.
Yeah, as it starts picking up. And she only has 1 paddle right now. Some people, depending on their body size or how they're structured, may have 2. We don't want it hitting any of the bones, her hips or her ribs, so I've got her positioned with just the 1 paddle, and that way we're able to get maximum muscle contraction, so it's just absorbing right into those muscles of the abdomen. And we can also treat the thighs and the butt as well, which is, the butt's a really popular next area of the body, because it all kind of goes together, but, you know, if you're going to be in a bikini or something like that, or you just want more strength, it's a really great option for building that strength, building the core. Increase your power in your squats. If you're at the gym, you're wanting more strength, or you're just starting your gym and you want to kind of give yourself a little bit of a push. You could definitely come in here, build some muscle, and then you'll see it, transform at the gym as you keep working out. Finish with her series, and then in 6 to 12 weeks, depending on her level of activity at home or how much she's wanting to keep up with it, everybody's a little bit different. She might come in at 6 weeks, 8 weeks, 10 weeks, 12 weeks, and she would be able to use one of those 2 maintenance treatments in the same area to keep it going.
Okay, so we have a question from Ellie. Do you recommend any special diets or fasting before the treatment?
You don't have to be doing anything special before the treatment. Of course, if you have excessive fat in the area to be treated, you might not be able to appreciate the physical change and improvement in muscle definition, because that fat layer would be covering that muscle, just like if you were trying to, work out. You still can build muscle, but if you have fat there, you're not really going to be able to see it. But you will notice the improvement in strength. So even if you do have fat there, I do have patients who have noticed improvement in overall strength of their core from doing the abdominal treatments. And if you have fat, that would be more Natalie with Coolsculpting, like you guys just saw. Do you do Coolsculpting or CoolTone first? Again, it depends on what your goal is. So if your goal is to build muscle in those specific areas, then I would probably lean towards CoolTone. But if you have more of a fat loss that you need to achieve prior to building the muscle so you can actually see that definition, then I would probably lean more towards Coolsculpting. And changes in diet and exercise, and then move you on to CoolTone to really chisel it all out and strengthen it up. Okay, and can you go over again how long the treatment takes? So depending on the body area, they're going to take different amounts of time. So with this machine, we're able to treat the abs, the thighs, and the buttocks. And they vary in amount of time between 20 to 30 minutes. So your first appointment is a little bit longer because we do pictures. We kind of talk about it, make sure you understand what's going on and what you're getting into, even though it's very tolerable. As you can see, Chelsea is doing just fine.
Oh yeah, she's actually
very comfortable.
Taking a nap.
And then once the treatment's actually going, as you can see here, the time is ticking down, and she's got 15 minutes and 27 seconds left, and then she'll be done. So there's Chris. What are you doing, Chris?
I was just hanging out, watching a little episode of Meat Eater.
Looks like you're drinking a glass of wine.
Hell yeah, drinking a glass of wine.
interesting. We've got our microneedling patient in here right now. She's getting her blood drawn. You're gonna see a microneedling, and after we do Melissa's lips. But anyway, they're drawing her blood right now. They're gonna spin it and get the growth factors out, the PRP. So now we're in with Nancy.
Hello guys again.
What are you doing?
So we're gonna do Melissa's lips. She's done them a couple of times, so just gonna do a little bit of enhancement, and obviously they're very pretty already, so we're just gonna make them a little more full, but that's what I have.
So here she is. She's kind of plumping her lips up. I know it looks painful, but it's really not.
Can everyone still hear us on Instagram?
And Facebook.
Give us a thumbs up or a high five or a wave.
And when they're, they have to wear their masks inside, but not outside. So
Oh, they're gonna look so pretty.
Side by side so they can see one side done and one
Yeah.
side done.
Good.
Can anyone hear us on Facebook?
Yep, all good.
I'll do that.
Here's Shannon filming on Instagram. Hi, Shannon. So earlier, we did Melissa's Botox. She's on Zoom calls most of the day, and she wants to kind of plump up under her eyes, her cheeks, her lips, and relax her muscles in her forehead.
She wants to look refreshed.
Yes.
Are the results instant for the lips?
Yes.
Yes, they are instant.
Melissa, if you're doing good, just give us a thumbs up. Easy. Okay, thumbs up. Melissa's good. No problem. Super numb. Got a lot of thumbs up. Super numb.
You can't turn while recording. Oh, I had to record.
So I'm gonna let this in, then we can show her side by side where one side's kind of done and one side hasn't been done yet, but you can see already how it's kind of turning up her, so you can see more of the pink
Oh yeah, look at that. That looks pretty.
compared to the other side.
Yes, she is doing one full syringe of Juvederm Ultra Plus. And then Nancy, is there any reason you're not injecting directly into the border and you're going from above?
So I'm trying to get this to turn up. That's kind of the technique, and it's actually so we can see more of this pink. So we're getting it to roll up more. There's many different ways. I am still going to go in here, but again, there's just many different techniques to do different things.
So Nancy's been with us for 7 years. She's an incredible injector with,
She's been with us 10 years.
oh my gosh, 10 years. How time flies. With advanced techniques in lip augmentation. So hey, Rich, here's
Hi.
Dr. Laconi.
I'm going to try to pick up a few tips here because Nancy is one of our best injectors, particularly in this lips technology and technique.
How long will the lips be swollen?
So I tell people the worst part of it is typically the first 5 days, but you can have residual swelling for 2 weeks, sometimes longer, depending on the person.
When can you go back to work? Is this a thing that's you can go back to your normal business?
You can go back to, especially now, wearing masks, because nobody's going to see these.
Oh, that's a good point.
So, it doesn't matter. Although you're going to have some swelling, it's possible you can bruise, but with masks, you're just going to see it, other than you.
Nancy, what's your favorite thing to inject? Part of the face to inject. What do you love?
I love doing lips. I love doing cheeks. I think I love doing all of it. I don't think I have a particular one that I love more. I just love for people to feel good when they leave.
And how long does it last for lips, typically?
So we tell people, typically for the lips, because you move, you chew, you do things, 8 months is typically, for the most part, most people. But up to a year for most of these products. But again, with the lips, because you chew, you talk, and you, all that.
It's
So.
looking so pretty.
Yeah.
We are using one full syringe of Juvederm Ultra Plus to do Melissa's lips.
Pretty. How are you doing, Melissa?
I'm doing good.
So who's a great candidate for lips? When do you know, if you've never had lips before, when do you know that you're ready for lips?
When you want them.
Okay, there you
That's
go.
pretty much it.
Okay.
I mean, honestly,
Is it ever too late? Like it's, we had some earlier, I'm 55, I'm 62. Is it too late for lips? I still want to look natural.
Never.
I feel like I've lost my upper lip is a big thing that people complain about. Or I have
Actually, I
those
think it's
lines.
done, to a certain point, it's a very natural way to refresh your face, just like the cheeks. I'd say there's a few areas. The cheeks, number one, just to give a fresh look to the face. Lips are right behind. just because the loss of the subcutaneous volume is what makes the face sag. Doesn't have enough air in the balloon. Balloon just sags. You know?
So you're saying if we get our lips plumped up, it'll help make the whole face look more
Just look a
youthful
little
and
fresher.
plumper and fresher.
And-
Okay.
More balanced. Also, I think having more balanced.
So, okay, let's look at one side done. Yeah, oh, it's a little swollen already.
Already, but yes.
Yeah, it's going to be beautiful.
Thank you.
So typically, Nancy, it takes about a week for everything to kind of settle into place.
Yes.
If you stop getting lip injections, will they look stretched out?
No.
So pretty. Melissa, again, you're getting a ton of compliments out there.
It's a good model because she's
So
know.
63 years old is not too old for lips.
no. We have different products that we can use that are a little bit thinner. It kind of depends on the person that's seeing you, and but no, you're not too old.
Let me take you guys out front to go meet our front desk girls. They're taking everyone's calls right now. Hey guys, here's our office. We're set up for Houston Life earlier. So here's beautiful Ariel and Caroline. So you guys give them a call. They're actually taking calls. We're back in the room.
Least input to that, but
Yeah,
But,
Nancy, you're getting a lot of high fives out there. We love Nancy. We had a shout out to you earlier. Natalie, also some of the injectors. Who are the injectors here at Institute that we should ask for if we're interested in lips or cheeks or anything else?
Okay, so we have Aaron, Nancy, Richard,
And Dana.
and Dana, but they're the best.
And then how many syringes do you need for the lips? Do you only need one?
Yes. One is a good amount.
Hi, Allison. I see you're watching.
Just because you don't want to do too much. If you do too much, and you can kind of lose the pink. So you can only expand so much. One syringe of filler is good for the lips. Alyssa had a glass of wine last night. So. It's okay. Everybody's different.
Awesome. This is great. You guys continue to ask questions. Again, if you're interested, DM us, call us. The lines are really busy right now. We'll be available tomorrow as well to take your calls. Leave us a message, DM us, and we'll get back with you. Any other questions coming in?
No, just we are doing one full syringe of lip filler of Juvederm Ultra Plus right now.
So Nancy, what are the big questions that you always get asked? Or Dr. Laconi, what are the questions that you always get asked for lip filler? Or questions on filler in general? What do people always ask you coming in for the first time?
Well, number one, of course, they all want to know if it's safe. And of course, my favorite response is that it's actually made of naturally occurring substances within your body. So everybody has hyaluronan in their body, and plenty of it, as a matter of fact. And as we get older, it's part of the signs of age is we start to lose that hyaluronan. So that's one of the principal causes for the for the appearance of aging. It's not a cause of aging, but it's definitely one of the causes for the appearances of aging is that loss of that fresh hyaluronan in your face, in your skin. It's a water plumper. It literally attracts water, keeps the skin hydrated. Without it, we lose that. So, in a sense, it's quite natural to restore that hyaluronan, and that's really what we do with this.
Love it. Awesome. And lots of reviews coming in, questions. How are you doing? Thumbs up, Melissa, if you're doing good. She can't move at all, but she is calm as a cucumber. Thumbs up.
Yes, we do.
Super numb.
We do put numbing cream on beforehand so you are not in pain when you come in. Some people will feel it a little bit, but some people hardly feel it at all.
Awesome. So we're just doing it. So we numbed her before. Okay, scale of 1 to 5. Truth be told, 1 being no problem, Melissa, 5 being super painful. Where are you? Just show. You don't have to move your lips. Just give us. Oh, really? A 1? That's it? Again, we keep her super numb if you want to. We try to make everybody really comfortable here. Looks great. She's doing great. You got a lot of high fives and claps out there.
Okay.
All right. Ashley said, love my lips that were done by Nancy. Y'all are the best. So thanks, Ashley. So sweet. She looks great. And so how much did you use for her, Nancy?
We use 1 ml of Juvederm Ultra Plus.
So 1 ml, 1 syringe?
1 syringe.
1 syringe. Awesome. Melissa, how you doing? Good?
Good.
So anything she needs to do differently at the end of tonight, she can go about her business?
A little bit different.
Yeah?
I ask people to no passionate kissing for at least a week.
Oh,
I know. That's just,
we won't tell your husband that, Melissa. We won't.
I ask people to avoid straws, water bottles, anything where you have to puff your lips and put pressure on them. I ask them not to do.
Just to keep your artistry
Yes.
perfect.
So
Got
that
it.
you don't move the filler.
Perfect. Got
No
it.
visits to the dentist.
No visits to the dentist. 2 weeks before or after.
Love it. And then, like we say, it settles, but she can go about her normal business
Yes.
other than that.
Other than that.
And then exercise always comes into question. A lot of people say, when should I exercise? Do you get, how long are you going to give her a pass?
So you're supposed to wait 48 hours with filler. I know she's going to be getting her cheeks done too and her under eyes, so for her it's going to be 48 hours.
Ooh, you're getting all glammed up. We love it.
Yay! Botox is 24.
Awesome. All right, we are going to take you guys. You keep working, Melissa. You did a champ. You were awesome. We're going to take you into the next room. Here we go. Okay, guys, what are we doing in here?
We are doing microneedling with the PRP, which is also known as the vampire facial.
Ooh. And so who is a perfect candidate for this?
The best candidate and what this does the most for is fine lines and for textural improvement, acne scarring, and just overall anti-aging, stimulating that collagen and keeping the skin looking nice and youthful.
Natalie, tell us what you're doing right now.
All right, so right now I am adding the PRP, which is that platelet-rich plasma that we did earlier, or that we did the blood draw earlier for, and we are going to start microneedling. Ready? 1, 2, 3.
So what is this essentially?
So what this is doing is causing teeny tiny little micro injuries that are little micro channels so that the PRP is getting driven down deeper into the skin. With those little micro injuries, the body's natural response process is to stimulate collagen and elastin and rebuild that skin structure. And that's going to help with the overall texture of the skin. It's also going to help with the fine lines. If she had acne scarring, it would help with the acne scarring. But what she has found is that it helps. One, she has a scar on her forehead that it's helped clear up from a little incident with the pepperonis. But she's also noticed a huge improvement with her neck, which earlier we were talking about tech neck. So Steph, now let you kind of go over the improvements you've seen in the neck area.
Just the lines I've found that are not as pronounced as they used to be. So I'm glad that we
Added that on.
added that for the first 4 treatments I did, and then we'll continue once a quarter to do that for my neck as well.
How long have you been doing this now?
Oh gosh,
3 years?
probably.
Probably. So Stephanie did her first series about 3 years ago. And then after that original series, just for maintenance, she does it once a quarter.
Stephanie, do you feel anything? Does it hurt at all?
Not at all. I mean, you feel a little bit of pressure, but it's not anything.
Do you need numbing for this, or is that
I
something
did
you
the
offer?
numbing.
You did numbing. Okay, so you don't really feel. Do you feel
No.
anything?
No, we do let all of our patients numb for about 20 to 30 minutes beforehand. I keep the numbing on the face as we go. I do remove it.
And we see it getting a little red right now. That's normal. How long does that redness last for?
So today she will be bright red. Tomorrow she's going to be pink like a sunburn. Tonight when she cleanses her face, it's actually going to feel like a sunburn. And then by Friday, she should be just slightly pink, but start to get a little dry and flaky.
Prior to COVID, I typically get my treatments on a Friday afternoon, and Saturday I'm pretty bright, But by Monday, I was ready to go back to work. I may have a little bit of peeling with makeup. You really couldn't tell that I had had the procedure done.
How long does it take to see results?
After the face heals, the skin just overall looks better the week after, but then it takes a couple weeks for that collagen and elastin to really get stimulated and see the results from there.
Stephanie, people are saying your skin looks gorgeous, and then they want to know, do you do Botox too?
Absolutely. Erin does my Botox, and I used to have lines in my forehead that would collect makeup, and you would see a big crease with makeup, and those are all but gone. So definitely a believer in Botox. Erin also does it around my crow's feet, as well as my marionette lines, and occasionally she'll add some Botox to my lips to help with the lines. Very pleased with my Botox results.
And then Natalie, does your skin peel after this?
Yes. It will kind of slough off. I find that it comes off the easiest in the shower, and as long as you keep it moisturized, it's not super, super noticeable. But usually day 3 through day 5, sometimes day 6 is the worst of as far as the dry like flakiness. And then from there, you can wear any kind of physical sunscreens. You can also wear mineral makeup if needed.
And who is this good for?
The best candidates are going to be, the people that are going to be happy with the treatment are ones looking for improvement with their fine lines, people that have acne scarring that want to improve those, and anyone with just overall skin texture. It really helps shrink large pores. And we have moved to the under eye area. Everyone hates these fine lines, and with the skin pin, we are able to get super close to that lash line.
Leave it to Natalie to get into all the crevices.
We also do laser hair removal. Gonna go on from there. We have a special on packages. Most people do not realize that with laser hair removal, you need anywhere between 6 to 9 treatments, and those treatments are spread out every 6 weeks. So you do want to start that pretty soon if you want to be ready for summer of 2021. Little tidbit there.
So we're doing, so on Skin Pin, is this, what is this used for? Who's the best candidate for this, or for PRP?
So with the PRP, it's going to stimulate a little bit more collagen and elastin and faster healing times. If you're that first 24 to 36 hours, this really does speed it up, where day 1 you're red, day 2 you're pink, day 3 pretty much all the coloration's gone, and you're just in that dry, flaky part of the healing process. If you do just regular Skin Pin, you're usually still pretty pink on day 3, and it goes into day 4.
So is this best for texture, lines and wrinkles, dark spots, redness?
Get a close up over here. Turn her to the side a little so you can really see that redness. You see how red that is?
Mm-hmm.
And that's good. You want the red?
Yes, we want that erythema. I have created a little technique that I'm doing multiple depths, multiple passes, and that I have found yields the best improvement texturally, especially with my acne scarring patients. We are seeing amazing results. I have a lot of patients that have come here from other offices that they haven't been happy and they're a little hesitant to try microneedling, but everyone that I have done has been so happy and they have phenomenal results.
And then you guys, if you are interested, give us a call. We do know we have busy phone lines, but don't give up. We'll be around all day today and tomorrow.
Send us a DM, we'll call you back.
So Natalie, tell us, how long have you been doing this for your patients? What's the number one thing that they say that they notice after Skin Pin or after their treatments?
Everyone loves how their complexion is just like this nice, glowy, healthy complexion. The pores are smaller, the fine lines are less noticeable, and they notice that as fast as they're healing. And then they get the added benefits that it just continues to get better. We've been doing the Skin Pin here for about, I want to say 6 years.
Yeah.
6 years.
6 years already. I feel like time has flied. But I mean, it's one of the best procedures that pretty much anyone can do it as long as you do not keloid, obviously pregnant or breastfeeding. All skin types can do this procedure. If you are a darker skin type, we do prep with a right-wing lightening agent just in case there's any kind of inflammation. PIH, which is hyperpigmentation, we don't want that to happen. But everyone is a candidate for the most part.
All right, well, thank you. And now we're gonna head in for some fillers in the cheeks and under eyes. Thanks, Stephanie.
Awesome. You guys are doing great.
Moving on to the next.
Hey guys, so we're getting ready to do some filler in the cheeks. Come on in.
What we're back in this room here, and we're going to look at doing a little something about a little dark shadow that occurs. Some people call this tear trough. It's right under the eye. A lot of people notice that one of the first signs, of the little earliest signs of volume loss is a little shadowing that occurs in here due to the little volume. Tear trough area. You doing okay? Now, sometimes I actually ask people to look at the ceiling briefly so I can kind of see this, because it opens up the tear trough and kind of, in a sense, it amplifies the volume loss. And I'm literally putting quantities of filler here that are smaller than a droplet. Just micro droplets. Slightly overfill it at first, just a little bit. But you can see, if this thing's camera's close enough, you can see the little cannula moving under the skin. So I kind of maneuver it in various little places.
So we have one question. Are fillers removable?
Absolutely. You know, well, let me just say this. Not all fillers, but the ones that we use here are. So anything that's a member of the Juvederm family of fillers is made of hyaluronan, that stuff I was talking about earlier. Keep looking up top here. Let's tap this a little bit to kind of spread it around. Thank you. And yeah, so the question is, are they removable? Absolutely. Yep. They're also massageable in the sense that, as you can see what I'm doing right here, I'm just kind of gently spreading this stuff around a little bit. So in a sense, when you first put it in, it's like modeling clay. So I've kind of put a little bit of the filler in there, and now I'm kind of tapping it down a little bit to kind of give it a nice, smooth, natural look. So by the time I'm finished, it'll just look like it completely filled that little, very slightly depressed area.
So a few questions coming in about what are you using? How do you decide the best filler to use? Where there's lots of different fillers out there, how do you decide the best consult
well,
for the...
Basically, just for looking at the Juvederm family, they have about 5 different products ranging from the original product all the way up to the most recent one. And Velour is like just, maybe about a year-old entry. It's the one that I like for lips. It's the one I like for under the eyes and a few other areas, whereas Voluma, a very, very durable product that we put just basically in the cheek because it really provides a nice round, in a way to volumize the cheek. That's why they call it Voluma. And then see right here, I just kind of put a little bit more. But it doesn't take very much. You can see that basically by the time I'm done, I'll barely use half of the syringe on one side. And just depositing tiny, tiny amounts. Then I come back and do the tapping routine.
So a few more questions. Some people say they already see the difference in some of the shadows with just a small amount. Again, we mentioned how many syringes does it take to fill a teaspoon out there?
Well, this is 1 cc in a teaspoon has 5 cc capacity. So it takes 5 cc's to make a teaspoon. This would fill up 1/5 of a teaspoon. In other words, it takes 5 of these to fill a teaspoon.
So,
that shows you how little it takes to do. You can see right away.
you can already see a difference. Yeah,
the,
some people are
you know,
noticing.
the shadow is gone. There's a little bit of pigment there, but that's also partly because just when you pass a cannula through, you'll see the slightest trace of.
So Melissa, if you can turn towards us so we can start, yep, that's perfect. So we can see, can you guys start to see a difference? Tell us out there if you can already start to see a difference from one side of the under eye versus the other. Perfect. And then what would you, I've got a lot of more, what would you use for lip lines? What are you using in the under eye areas? How long does it last?
This is the under eye. Yeah, for lips, that's velour. That's what we have right now in my hand. For if I wanted to round her cheeks a little bit and put a little bit right out here in the apple of the cheek, I could put some Voluma right there. And basically, since she doesn't really have volume loss, but I could raise the cheek a little bit and give it, you know, some people believe, you know, that high, well-defined cheek is kind of a glamorous thing to have right now, kind of like well-defined full lips. And so if that was the object, then I could put some right out here, and right out there on either side, just to give a little bit of a cheek lift, if you will.
Yeah. Everybody, we got a lot of comments in here. Everybody said they're noticing a difference. Yes, already. Yes, yes, yes. See a difference. Thumbs up, high fives, big difference. And their question, how much did you use so far? I think that was half a syringe so far.
Not even quite half. I've done about 4/10.
Okay, perfect.
So I've got 6/10 remaining.
We've only done one side. For those of you just joining, we've only done one side on Melissa. She's injected almost half a syringe. We're targeting underneath the eye area. What was the product you're using again?
Velour.
Velour.
Juvederm Velour. That's one of the Allergan products. So I'm just going to come and put a little bit out here.
Looks amazing. Shannon, can you go over filler pricing and how to get on fillers to take advantage?
Yes, so filler pricing, what he's doing right now is 1 syringe of Juvederm Velour under the eyes. Regular price for that is $7.50. It's on special buy 1. However, when you buy more, for instance, say you buy 2 syringes, they're $600 per syringe. So pretty much the more you buy, the more you save. So for example, when you buy 1 syringe, you're saving $125 per syringe. When you buy 2 syringes, you're saving $150 per syringe. When you buy 3 syringes, you're saving $200 per syringe. And when you buy 4 syringes or more, you're saving $250 per syringe.
And so we're going to do before and after pictures. We took before and after pictures of Melissa. We're going to show you guys before and after pictures when all of this is done. Any questions out there? Let's see. A lot of new people joining us and saying hello. Filler, there was a question of what we used on her lips. What was that again?
Juvederm Ultra Plus.
Thanks, Nancy. What might be best for you? Call us and we can walk through it with you or give you a live consult.
Is your number one. I think almost everybody here at this office uses velour for under the eye. Again, lips and things. There's everybody has some favorites, and it kind of depends on what you're trying to achieve. But under here, see how that's down nice and smooth. And got a little smoothing I'm going to do over there. Just a little tiny red.
Yeah, it looks very natural. So does this help with dark circles or under eye bags, or what do we do first?
There's a lot of things that cause under eye bags and dark circles. Some of it is pigmentation, okay? So the eye tends to naturally form pigmentation in that area called a tear trough. That's what we call that, the area of the tear trough. Kind of a purplish looking discoloration. That can be pigmentation, that can be blood vessels. But if it's just shadowing due to a basic little depressed area, then this will dramatically help because it gets rid of the shadowing by filling in the little depressed area. So,
and we saw some of that.
So this is really, that's great. And of course, look how the camera.
So yes, questions. Is this instant, and how long does this last?
Well, you can tell it's instant.
Yep.
It is instant. It's one of the greatest things about dermal fillers is instant gratification, something we all love and crave. So yeah, that's where it is.
A lot of, oh wow, it's very
That's where-
impressed. Big before and after difference.
So, next thing we're going to do is a little.
You have a couple minutes to do the cheek filler.
Okay, I'll come back over this side. And we're going to demonstrate this cheek filler and what you can do to kind of round out the cheek a little bit. This is done with the balloon.
Melissa, how you doing out there? Good? Yeah? Super comfortable, numb, not numb. Tell us how you feel.
Numb and just feel pressure, and that's it.
Okay. All right.
Well, neat
It's the
part
last
about
time
this
we hear
also,
from you.
by the way, is that we only made one hole on each side. You can do basically all of this through that. So, in other words, I don't have to keep sticking her.
And so a few questions that you don't have to answer. You just keep doing what you're doing, Nancy, if you want to. But we're a few questions on bruising. Will she bruise? We don't see any bruises right now. You look good to
Bruising
go.
Yeah, that would be very unlikely in this procedure.
Looks really pretty. Nice.
All we did was accentuate the cheek that she already had. So most of it I put right up in here. That helps raise and accentuate and give it a little bit more dramatic look to the cheek.
So now we're going to go actually see the Diamond Glow in progress. Sorry about the shaking. So what are you doing, Carly?
We are doing a Diamond Glow on Miss Darlene. This is my gorgeous client. She loves this treatment. We're polishing her skin, we're doing some extractions, and most importantly, we're infusing Allergan's new TNS Essential Serum. So they came out with the TNS Advanced Serum recently, which is phenomenal. And they've expanded into treating procedures in the office, and this is that application. So I'm simultaneously removing dead skin cells, extracting dirt and debris from her pores, and then re-infusing her skin with the TNS serum. And we just got it in the office. We're super excited about it. It's going to help with overall anti-aging. So the Diamond Glow helps with specific skin concerns. And we usually will go over which serum to choose for you that we're infusing into the skin, be it for brightening, which is usually what we do with Darlene because she's got a few little brown spots we've been working on. We have a pore clarifying solution that has some ingredients to help tackle acne. We have a vitamin C solution, and what's the one that I'm missing? Hydrating.
So
A hydrating solution. And then the TNS.
Who's a good candidate for Diamond Glow? Like who would need a Diamond Glow?
I think everyone could benefit from a Diamond Glow. I mean, even if you don't have any of those specific, things that I may have mentioned, just getting a good exfoliation and reinfusion of some hydration is always a good thing. Even if you have, really aggressive or acne issues, we can still kind of work around that and help calm things down with the facial. There's different tips that we can attach to. But it's always good to come in and do a little consult, and we can tell you if you have more specific questions.
So what are we using right now on her? What is she using?
This is the TNS Advanced Serum.
So what is that for?
This is a growth factor serum. So it's really the ultimate anti-aging facial for the Diamond Glow. It's infusing her skin with lots of nutrients that are really going to help kickstart her collagen, elastin production, give her a nice glow, obviously, Diamond Glow, and help remove all the gunk in her pores, which is accumulating right here. So,
Okay, so what are we looking at? So we're looking at the jars right now. So one is the serum. The blue jar is the serum.
yep.
And then that clear jar, what's in the clear jar that's coming through?
So the clear jar is full of her dead skin cells, and then some of the waste solution that's not making it into her skin. But you can see as we go over, she gets a little bit pink
Yeah, we see those dead skin
from the
cells.
vacuum. And then she also gets this really nice glow from that infusion. So she's going to leave really nice and plump. And we turn this way and we'll do this side. And it all collects in the jar, and then we get to look at it. and ooh and ah before you throw it down the drain. It's just the best part.
So how many treatments do I need?
So this is really something that's a good monthly investment. We do have series that you can do, and you know, some people may want to do, you know, alternating with some other procedures that we have in the office. This plays nicely with almost everything that we offer. So you can work it into your regular regimen if you're doing chemical peels or laser treatments, filler, Botox. We just have to kind of talk about timing. But generally, I have most of my clients coming about once a month for these facials, just because they do such a good job at getting that monthly maintenance and cleaning things out, keeping things fresh, helping your products at home to work really nicely, and keeping it all moving.
You're loving. You have a lot of Diamond Glow is amazing. I love this. Hi, Carly. Lots of high fives out there for Carly. And then question is, can I use this if I have Botox and filler? Can I get it done the same day? Can I use it if I have that?
So you can get it done the same day, but the only way to do that is if you do this first.
Got it.
If you do this after, you run the risk of moving any injectable around, and that is not what we want. But if you do it first, you come see me or Natalie, the other esthetician, who's phenomenal, and then we'll transfer you to your injector, and they will do your injections, and yeah, then you're good to go.
Does this clean the stubborn blackheads?
It will help to remove and loosen blackheads, but I often go back in and do some manual extractions as well if I need to.
And then is this great when we see her a little bit pink right now, but is this good for like a weekend glow, or if I need to get event ready? Is this what you want, or is that more of a peel? What do you use for that?
Well, it depends on what we're trying to fix, but essentially, yes, you can come in right before your event. I probably would do the day before so that your skin has time to kind of settle. And you can get this done. You should be good for the weekend. The only thing that I would say is if you've never had one, I wouldn't recommend doing it for the first time right before your big event, because you just never know how things are going to go. You always want to do something at least a month in advance so you know for sure that it will work for you.
Awesome. Well, thanks so much.
You're welcome. And she won't be pink forever. We're just getting a lot of circulation going, and you know, it's good.
Life is normal afterwards. There's no downtime.
No downtime. No, she's actually going out for a drink out.
All right, now we are off for another filler demo. Hi, Nancy. Hi, Melissa.
Hello.
We have two Melissas, same day, back to back.
Hi.
It's a good name. So what's going on in here? Doing a little filler?
Yes, we're going to do a little filler. So we're going to just do a little bit in her cheeks. It's going to just kind of help work where she's getting this, where her fat pads are starting to separate. You can see this little malar crease. So she's going to kind of help pop this out a little bit, kind of lift her a little bit, and then we're going to work on doing her marionettes.
Talk a little louder.
Oh, and then we're going to do a little bit in her marionettes.
And turn her corners up.
And turn her corners up.
I just lost on my baby weight though. Are you going to make me look fuller? Because I don't want to look fuller.
No, we're not going to look fuller. So we're not going to do very much, just a little.
So yeah, it looks like we have a little loss of volume, kind of like in this area. So what product are you using, Nancy?
We're using Voluma for the cheeks.
Oh, so already you can already see like a little lift in her cheek. Just gives her a little natural lift and kind of takes away, like you can see here, she's got a little loss of volume. And look how that just a little bit of filler helped lift it.
Melissa, can you turn this way a little bit? Perfect.
Looks nice.
No, you're
Okay. So now what she's going to do, she's going to give her a little volume to, are you going to turn up her corners, or what are you doing? So look at that, how her corners are turned down. Watch what happens. It's instant. And guys, I know it looks painful, but it really isn't. We have a beautiful, great numbing cream. You know, it really numbs the area really nicely. Hey Morgan, my little Morgan's watching. Morgan, you might need some lips for your graduation present. Just kidding.
Stop. You're making me laugh.
I'm sorry. I'm sorry.
Stop. I'm laughing.
She's only 17.
I'm sorry.
She's only 17.
For your graduation present.
It was just a joke.
Oh, I know. That's why I was like,
It's actually.
I'll take your graduation.
Oh no,
present
it's
for you.
actually like my little niece. So you can see it doesn't hurt the fact that she's laughing. Oh yes. So Morgan said, "Oh yes." She got accepted to A&M.
Oh, congrats! Oh my gosh, that's awesome.
I know, Morgan. We're so proud of you.
They were making me laugh, so they had to stop.
I know.
Cut.
I know. Okay, I'm done.
So Morgan, yeah, you're next, girl.
And then someone's asking if they buy a filler for the lips, but the doctor feels like they don't need the entire syringe in the lip. Can it be used somewhere else in the face?
Oh, absolutely. There's always a place you can fill, especially over the age of 20 or 30. I mean, look how, okay guys, look at this. Look how that half of a syringe, what that did for her. It turned one side up, so one side is up and one side is down. See, it's instant. Can you see, Shannon?
Yeah.
I think Shannon's trying to log in. We're doing Facebook and Instagram Live, but look at the difference there. That's quick and easy.
So I love my filler so much. This is only the second time I've ever gotten it.
Really?
Yeah, so you did it the first time, and there was some extra, so you used it, and I thought, well, go ahead and fill it out, girlfriend.
And you know what? I mean, Melissa, she's always nervous about it. We make sure we do not overdo anyone here. Okay, guys, again, look at this one side of her face. This whole one side is lifted, her corner's turned up, and this side's kind of deflated and down. Look at the difference there. I mean, it really is huge. Can you get that, Shannon, for Facebook? Come on in really
You want me to
close.
smile or just keep
No,
on?
just stay straight, because you can see, like, look at the lift. See how this side's turned up and we did the fullness? It looks natural. Sorry. It looks natural. And this side, again, we're going to come back in and do this side later after the show, but really, can you get in there, Shannon?
Yeah, I got it.
So anyway, we're all about not overdoing, over plumping, and you know, that's why I think you feel safe here, right?
Oh yeah, definitely. I only trust these people. My only place I've ever gone.
And Nancy, our fantastic,
Thank you,
beautiful,
Nancy.
beautiful nurse
Thank
Nancy.
you.
Thank you, Dana. Thanks, guys.
Thank y'all so much.
You're welcome. We'll let you guys finish up.
All right.
Where are we going next, Shannon?
For Dr. Laconia to get his Botox.
Oh, really? Uh-oh. We'll see what's going. We'll see if he can handle it. Let's go see what's going on. So anyway, here's our office. Let's see what happens. Okay. Oh, here we go. So here's Erin, our other beautiful nurse. She is amazing. How long have you been here, Erin?
I've been here almost 8 years.
Wow.
Yeah. So
Yeah.
About 7.5 years.
Yeah. She's incredible.
I feel really lucky to be part of this practice. I've learned so much from this guy.
Well, Erin's just intrinsically so gentle and so empathetic. She's just great. She does a great job. And her skill level is incredible.
It is incredible. And you are a physician trainer for teaching doctors and nurses how to do Botox and fillers, and I think that's what you meant.
Right.
That is what I meant. I mean, so how lucky am I to get to work with someone who gets paid to train people all across the country, and I get to work with him. I get paid to work here. How lucky am I? So I've learned so much. He's one of the best in the business, so I hope that makes me a better provider too.
You're amazing, even without him.
Aw. So now I'm going to mark him for his Botox.
Okay.
So, Dr. Laconia, frown for me. Bring your eyebrows together. There you go. So he's got a pretty strong muscle here. So I'm going to mark where all these muscles tug at the skin. Now relax. And now raise your eyebrows up really high. And we don't want to freeze his forehead. We want to still give him a little bit of movement in here. Relax. And big smile. Good. And I'm going to try and lift your brow up just a little bit at the edge too. You got a little bit lift that's possible. Relax. And then we were just talking about this muscle that tugs the corners of the mouth down. So we'll put some Botox.
And you know what, Erin? Of course, not since I'm his wife, I can be critical here, but he is really overworking his whole lower. Clench, Richard. Do your clenching.
Try to bring your chin up too.
Pretend like you're mad at. Oh, look at that.
Yeah, we can put some in there as well.
Yeah.
Definitely.
And what about these little neck bands? Look at those neck bands.
Yeah.
I need my husband to look young.
Let's stretch the pretty soft neck. Get it back nice and tight and long, elongated. We can do that too, for sure. Okay. So try to frown with your mouth for me. Try to turn the corners of your mouth down. There we go. Good. Perfect.
Yeah, I was worried about it.
And let's do a little bit right here where he's got the cobblestone look.
Sure.
So anyway, we're doing Facebook and Instagram, so that's why we're Shannon's behind the camera.
Erin, how many units are you using on Dr. Laconia?
Well, we just added a little bit. So we were originally going to do 56, but I think we'll add about 11.2 on this neckband, maybe about the same in this one.
Oh, I can show you.
You can do some, yeah, see that he's strong. And then we'll also add about 4 in his chin. So it'll end up being about 80 something units.
Stop it.
Anything like that?
Can you Botox him so he can't talk anymore?
I'll do my very best. That would normally be a non-desirable outcome, but you know, we'll see. We'll start up here with his eye.
I do it really big. It looks like the creature.
It really does. You definitely need those. Yeah.
Now, can you rest your head back for me? Is that comfortable? Is that okay?
It's good.
All right.
Hi, Ellen. I see you just logged on. I sure miss you, girl. Anyway, so we're Botoxing Richard, the doctor. He never gets treated here unless there's a special event because we're always so busy.
I know, what do they say? The cobbler's son has no shoes.
Right?
Has she started yet?
Oh, yeah. So we call Erin our Disney nurse. She's so sweet. She doesn't hurt. You don't even need numbing cream when you're getting treated by Erin. All of our injectors are amazing, and
Well, that's a super fun place to work, that's for sure. We were just talking about how annoyed we get when companies try to sell creams that say better than Botox.
oh yeah.
You know, it's so silly because there's no way to stop a wrinkle from forming unless you stop the muscle from contracting so forcefully, increasing the skin, right?
Right.
So how can you try and sell some cream that you claim is better than Botox? If you don't stop the muscle moving, that wrinkle's gonna be there. So what we're doing is stopping these muscles that crease the skin around his eyes. We'll just kind of soften that forceful contraction so that when he smiles, he'll still have like a masculine crinkle at the corner of his eye. We just want to keep these lines from extending toward his temple.
Right.
Right?
So how are you doing?
Doing great. Getting my Botox.
Your Botox.
There you go.
Botox.
Botox time.
So basically with Botox, you'll start to see it relax. The muscles relax in 2 to 3 days. It gets progressively better every day. Your maximum results in 14 days.
Exactly.
So,
And with patients, we always like to do a follow-up appointment and make sure everything's perfect and we get your exact treatment just the way you want it.
anyway, so Chris is looking for some hot ladies. So now he's going to be nice and lean. A lean, mean killing machine.
In 2 months, right?
Yeah. Yep. So anyway, let's go check on everyone. See if we can finish. Oh yeah, that really kind of helps relax that lower jaw. It even helps with jaw clenching.
It does, and we call that puckering. Sometimes they call it pot orange, orange peel.
Right.
And so this helps to prevent that, so that we have a more smooth, more youthful looking chin. So now we're gonna just get his forehead. I'll be on my tippy toes. Oh no, you're fine. Don't worry about me.
So I'm going to check on the other girls. Do you guys have any questions? For some reason, my Facebook is not sending questions in. So if we didn't answer your questions, feel free to DM us, to send us an email, call us up, and ask us questions. How are you guys doing in here?
Good, just finishing up, putting on her last little layers of facial goodness.
Oh, nice.
Looking nice and glowy and fresh.
How was your treatment?
Oh, it's perfect.
Oh, that's great.
I'm obsessed with the Diamond Glow and Carly too.
Of course, we're all obsessed with Carly. Do you happen to show? Oh, you've already cleaned out the jar. Because sometimes you can see.
It's over there.
Oh, let's see what it looks like.
It's right here.
So you can actually see all the stuff that comes out of the skin. Carly's going to show it to us. This is really cool.
Light.
Yeah, okay. Even though her face was clean, you can see all the stuff.
See all the floaties?
The dead skin, the floaties. Hold on, let me see if I can get a good look at it. Anyway, this is an amazing procedure. It really does deep clean, exfoliate, and your skin just looks beautiful the next
So
day.
glowy and fresh.
Yes.
And
and smooth, although her skin's already like.
Yeah, you already have beautiful skin.
She's been on a good regimen.
I have, yes.
That and the redness goes away in how soon?
Usually within an hour or so.
Okay, good. Well, thanks for being our model today.
Thank you.
Bye.
Okay, bye guys.
Bye.
Let's see what's happening. So how are things going in here? How's it look? Let me
So
see.
good. Here's the opposite side. Looks so good.
Oh,
We have a little
nice.
bit extra, and I was thinking about putting it right here. What do you think?
You know what I think? I'm thinking we need a little bit right here. I'm thinking, look at that. It's just a little.
Oh, I think it looks great.
You guys are amazing.
First time I ever did it live with you all.
Isn't it fun?
Wow.
No big deal, huh?
So we're gonna go just the ultra plus a little bit right here.
I'm thinking like I see like a little loss. See how I'm just seeing like a little loss right there.
Are you gonna open another balloon?
Yeah,
I'd
yeah,
rather do balloon.
yeah. Just you see that? I just see like a little crease. Are you wearing your mask too tight? That's a good question because some people that are wearing their mask too tight are getting that little
Really?
kind of breakdown. So make sure you're. I know that they tell you to wear it tight, but
Yeah.
if you're investing in all these fillers,
Yeah. I'm like, what does the CDC say?
just do. But it does look good. It does look good. I'm just thinking just a little dollop. But anyway, guys, have at it.
Thank you so much.
You're welcome. So, we're all done, guys. Thank you guys for joining us. Again, hi Ariel, how are things going up here? Yeah.
Call you back.
Yeah.
So anyway, guys, hey, we wish that you guys could come and drink some wine with us and have some food because we're about ready to start the party. Everyone that's here, all of our
Have you
patients.
done all the demos already?
We're
Yes.
done. We can start partying.
One last question. What is the recovery time for the CO2 fractional laser?
Okay, there's the acute recovery is about 4 days. And that's when after that period, you're able to go out in the public, okay? 4 days. Now, from about 4 to 5 days on to about 2 weeks, you'll be nice and clean, but that's easily remedied with just a light dusting of hourglass, something like that. And then all the good benefits start to appear at about 2 weeks and head all the way out to 16 weeks later. And it's going to last, it's basically permanent.
And the CO2 helps with texture, correct?
Absolutely. Tones, textures, and tightness.
And someone said they can't get through. It's because the phones are just ringing off the hook. So keep trying. If not, call us tomorrow.
Yep.
And we can definitely honor the same specials.
Right.
Come on in. You're good. So any more questions, guys, before we go?
You can still call in, even if we're not out on the air. And tomorrow also.
And then Dr. Laconia will look 10 years younger in a few days.
Tomorrow. I'm going to wake up in the morning and look like a baby again.
About 14 days, though.
Yeah, 14. All right, guys, signing out. Love you guys.
Bye.
Bye.